Hi, my name is Blair Davenport, and I'm going to be talking about the importance of sleep. Did you know your genes affect how much sleep you can function off of? While the recommendation is 9 hours per night, some people can function off of more or less depending on their DNA. Sleep is an essential function that lets your mind and body recharge, allowing you to function to your fullest potential. There are three main things that we're going to hit on today. First, we're going to learn about the sleep stages and the sleep cycle. Second of all, we're going to talk about sleep disorders and how they affect daily functions. And lastly, we're going to look at a sleep study done on college students about college performance in the classroom, depending on the quality and quantity of sleep. However, to start, we'll talk about the three sleep stages. A key term we need to know before talking about the sleep stages is REM sleep, which is your deepest form of sleep, your stage 3 sleep. Now we can go back to stage 1. Stage 1 is the dozing off stage, and you cannot function to your fullest potential if you are just consistently getting stage 1 level sleep. It will not be sufficient enough for you to function to your best cognitive function and natural productivity. Next is stage 2, and this is your more subdued stage of sleep, but you're not yet in deep sleep because your brain is still having short bursts of active stimuli. Lastly, we do have our REM sleep or stage 3 sleep. It is your deep sleep, your most peaceful form of sleep, and it is the most critical stage of sleep in mind and body restoration. And this is the sleep that we should be getting on a consistent basis. Now, why do sleep stages matter? According to the Sleep Foundation, sleep stages are important because they allow your brain and body to recuperate, and failure to obtain deep REM sleep will explain some profound consequences in insufficient sleep. Now that we know about the sleep stages, we're going to talk about sleep disorders. Nearly 70 million Americans have sleep disorders, according to the CDC. Sleep disorders greatly affect daily lives, causing depressed mood, tiredness, and decreased productivity. And in the long run, it can cause some bigger health problems. The two most common forms of sleep disorders are insomnia and narcolepsy. Insomnia is the difficulty falling asleep, and then narcolepsy is sudden attacks of sleep. This is actually extremely dangerous. The cause of insomnia is chronic stress disorders and depression and some chronic pain, but it can be fixed with things like medicine, light therapy, and change of daily habits. On the other hand, there is no treatment for narcolepsy because narcolepsy is genetic, but it's also the lack of hypocretin, which is a wakefulness brain chemical. And there is no end-all be-all treatment for narcolepsy. Sleep disorders have a huge impact on quality and quantity of sleep, and it's important for them to be treated ASAP. Lastly, we're going to talk about the quality and quantity of sleep. MIT did a study on better sleep habits lead to better college grades. This study was organized by David L. Chandler and was published in 2019. There was one huge takeaway from this study, and that is the quality of sleep is just as important as the quantity of sleep. In the study, it is talked about how the hours you go to bed affect the quality of sleep. 9 hours is the recommended time for you to sleep per night. But if you sleep from 10 p.m. to 7 a.m., that is going to be different quality sleep than if you sleep from 2 a.m. to 11 a.m. The quality of sleep will be different because your body is programmed to shut off around anywhere from 10 p.m. to 12 a.m. So your internal clock will be knocked off kilter when sleeping at these random hours of the day. This is the reasoning you should only take 20 to 30-minute naps because anything beyond that will mess with your internal clock and ability to fall asleep. This study was done on students specifically, and in the end, the conclusion was that sleep, both quality and quantity, affects classroom performance. Quality and quantity of sleep are very important, and as we see, especially in students. This makes a full circle connection back to the sleep stages and needing to sleep to the full cycle in order to have high productivity and proper cognitive function. Sleep is an essential function that lets your mind and body recharge, allowing you to function at your fullest potential. We learned about the sleep stages, how sleep disorders affect, and the quality and quantity of sleep. So next time you think about staying up watching TikTok until 3 a.m., remember the importance of sleep is a necessity for our mind and body, and it's a mood booster. Thank you.